has always combined its internal research and development efforts with licensing activities. In this way, we are able to provide innovations to ophthalmologists in a continuous manner.
Hasta la vista SIFI.
Hasta la vista SIFI.
The patient that undergoing cataract surgery for presbyopia correction is today a dynamic patient. He uses the tablet, the smartphone, and the computer, and he needs the vision for near, for the intermediate vision in a very speedy way.
Adesso sul mercato ci sono delle lenti che consentono di soddisfare appieno le esigenze refrattive del paziente. E la novità in assoluto è la lente che consente di correggere appunto la presbiopia, ovvero la lente multifocale o ancora meglio la lente progressiva.
Hasta la vista SIFI.
Cataract refractive surgery, if the patient has a problem of dry eye, treatment is necessarily to be performed before, and if the surgeon decides to implant a premium IOL, then the prevention of the relapse at this point of the dry eye problem comes after with a protocol of treatment and maintenance that must include ocular lubricants. In this context, SIFI plays a very important role because from the therapeutic point of view gives very important hints about the treatment of ocular surface with important news and important tools such as the mini-well lens, which are very important novelties in this field.
Patients receiving this kind of IOS need to be perfectly metropic after surgery. This means that we need to rely on the most accurate measurements for axial length, like optical biometry or immersion biometry. We can reduce the percentage of eyes with a refractive surprise higher than half a diopter. These patients are easily not perfectly satisfied after surgery. So I think that the preoperative diagnostic is one of the most important things to take care of when we see our patients.
The market of presbyopic correction is getting extremely innovative at the moment, and we've started with the mini-well this year, and I'm amazed actually about the good outcome that we had. Usually it's the first patient that you have who puts a kind of impression on you, and the very first one I had excellent outcome, 20/20 vision distance, intermediate and near, and that really pushed us to move on and to try the lens and to start international study and a local study with the product.
What we can do is to perform a surgery with a progressive intraocular lens that means that the patient sees very well from far, from computer, medium distance, and only for very, very near need a +1 lens.
We have internally developed a new generation presbyopia correcting IOL whose brand name is Mini-Well, and is proving very effective and safe according to the clinical data that we're gathering. We complement it with licensing activities for a novel compound that treats diabetic macular edema, who's a novel intravitreal implant with a 3-year controlled drug release profile.
The meeting was huge. We topped the London meeting, 8,500 delegates here, all sessions packed, and a lot of enthusiasm across people. I think ESCRS now is the leading society for ophthalmic education and science in anterior segment surgery in Europe, and I'm looking forward to see all of these delegates in Copenhagen next year. There will be another president. My term is closed, however, so far, so great.
Hasta la Vista SIFI!
See you next year in Copenhagen.